You've probably heard about the potential twindemic of COVID and the flu this winter, but what about a possible tripledemic? And what can you do to stay safe from a potentially active flu and COVID season this winter? 9 News health expert Dr. Payal Kohli joined me, Chris Bianchi, for a sit-down about a possible tripledemic. All right, Dr. Kohli, I want to get into the tripledemic. So we've heard about the twindemic, I think many of us, COVID and the flu, but what is the tripledemic?
So the tripledemic, which we had worried about for this season, but it's now actually become a reality, is COVID, flu, and a third respiratory virus called respiratory syncytial virus, or RSV. And you know, a few weeks ago, we were talking about this theoretically, Chris. We were saying it might come, but today we're actually living it. We're already seeing a surge of all three respiratory viruses occurring at the same time. And it's kind of an interesting perfect storm, so to speak, because the masks have come off this season, right? So that, respiratory viruses spread by person-to-person contact. Our COVID immunity has probably waned, and only about 5% of Americans have gotten the most recent bivalent booster that actually protects against the new variants. There is, in fact, 2 new variants of COVID out there right now, which are subvariants of the BA.5, which are quickly becoming dominant all over Europe and are expected to become dominant here in the United States as well. And then on top of that, the flu. We haven't really seen the flu or RSV for the last 2 years. So our immune systems, in a way, are a little bit naive, a little bit out of shape. And so it's the perfect storm of all those factors coming together that's really led to a surge in October, so early in the season.
Have we seen any cases of the tripledemic yet where people have had the RSV, flu, and COVID simultaneously?
We haven't seen all three occurring in the same individual, but certainly in the same communities. So we have seen hospital systems being overwhelmed by surge of patients with all 3 different types of illnesses. And all of them are respiratory infections. All of them can really affect the lungs, which means they can, make you need a ventilator or need intensive care units. And so we're getting back into that situation where we were a couple of years ago, where we were worried about hospitals nearing capacity. And many local communities, children's hospitals especially with RSV surge that we're seeing, are coming close to capacity already so early in the season. So, as time goes on, things are only probably going to get worse, not better, because we congregate more indoors. The viruses wake up a little bit more when the weather is cooler and they spread more efficiently. So we really need to brace ourselves this winter and do all the preventive things that we can to minimize the chance of all 3 of them hitting our hospitals at the same time.
I know you've already described RSV a little bit here, but maybe anecdotally, maybe it's because I'm not smart. I don't know what it is, but I don't feel like I've heard a ton about RSV before. Could you get into more detail about what it is and why we're hearing about it now?
Yeah, RSV is respiratory syncytial virus. Most of us have had it. Most kids usually have it before the age of 2. And when adults have it, it's pretty mild. It usually involves kind of the neck up. So what I like to call upper respiratory tract symptoms. So very much like a common cold. You have a runny nose, you have sneezing, you have stuffiness, you have a headache. You could have a little bit of a cough and a little bit of a fever. At the extremes of age, so we're talking really young kids or really, older adults, pregnant women, or immunocompromised, it can do neck down. So it can involve what we call the lower respiratory tract, where it can really start getting into the lungs, cause inflammation of the bronchioles, and that's when it can really cause some of those very severe symptoms that can end you up on a ventilator in the hospital. The infection usually lasts about 5 days, sometimes up to 7 days. It can even go up to 2 weeks, but the cough that occurs as a result of RSV can sometimes last for a month afterwards.
Which of these, I guess, individually, between the flu, you mentioned it's been fairly dormant for the last 2 years, COVID, 2 new variants, and RSV, any one of those individually that's got you particularly concerned at this point?
That's a great question. I would say probably of those 3, still the COVID-19, because it's the newest. We don't know much about this BQ1 and BQ11 variants that are coming, that are becoming dominant. We don't yet know if they have immune escape. In other words, will the vaccines protect us? Will they infect more of the lungs, like that Delta variant and the original Wuhan variant, or will they be kind of more Omicron in their behavior? Now, they are descendant from an Omicron variant, so we're hoping that they're milder, just like the Omicron variant. But the fact is that our behavior has put evolutionary pressure on all three of these viruses. The fact that for the last 2 years we have been wearing masks has created more susceptible hosts for the virus, and it's changed the way the virus's life cycle is occurring. So that's why we're seeing this peak earlier. It may have also changed the viruses themselves, so we don't yet know the mutations in this year's RSV, in this year's flu, and how those impact into whether or not somebody might need hospitalizations. But we do know that we have never before seen this. We have never before seen that in October, we are already seeing so much flu activity. And this is very much what happened in the Southern Hemisphere, so it's not surprising that it's happening here. But usually the CDC tells us to get our flu shot by Halloween. This year, we're already seeing people getting the flu before Halloween is even here. So it's really very different. The virus is behaving differently, and I think that has in a large part to do with the fact that our behavior changed in the last couple of years.
Totally anecdotal, but I have noticed a bunch of my friends, my family, getting sick this month, and to your point, it does feel like more and more people are getting sicker earlier. What can we do now to prevent this tripledemic or any sort of thing like this?
Well, the good news about COVID and the flu is that we have vaccines. And the vaccines do a really good job at keeping you out of the hospital. They may not protect you altogether from the infection, but they definitely reduce the severity of the infection. So if you get that vaccine, even if you get the flu or even if you got COVID, it's much likely to be much less symptomatic, less severe. Now with RSV, we don't yet have a vaccine. The researchers are actually working on a first ever vaccine for RSV. So hopefully at this time next year, when we have this conversation, we will have a triple vaccine for all of these three respiratory infections. But I think the best thing we can do, knowing that it survives on surfaces, it transmits through person-to-person contact, is hand hygiene, keeping our surfaces clean. If you've got little ones at home, just making sure that you're washing their hands, making sure you're wiping down surfaces, especially if they go to daycare, because we know that the virus can survive more hardily on hard surfaces like tables and railings and doorknobs, a little less so on the softer surfaces like bedding and such. But it's really important to not get fatigued when it comes to staying clean and hand hygiene, wiping things down. I feel like after COVID, we all had a little bit of a sigh of relief that we didn't always have to wipe everything down. Now that the vaccines came out and the variant was milder, but now heading into this winter, knowing that this tripledemic is not just looming, but actually here, I think we need to shift back into that mode a little bit.
I guess final question here, which I noticed was interesting that you didn't say masks, because I think that the masks have come on. Is this, in total question, is this more social science or is this actual science? Because, again, we see it all around that people just aren't really wearing the masks anymore. Is it kind of a lost cause? I don't know how to put it. Is it, people are very fatigued, I think, with the masks, right?
I mean, I wear my mask in the grocery store. I wear my mask when I'm running errands, and I don't always wear masks if I'm giving a lecture or having a meeting, but at work, and I see patients, I wear a mask. The masks work. 100% they work. And if it's not something that you feel is impairing the quality of your life, it is tremendous in terms of the impact on prevention. And not just for one virus, but all these three plus others that we haven't even mentioned, adenovirus and others that we can get as well through respiratory contact. So for me, heading into the winter, masks are going to be a big part of my preventive strategy to keep myself and my family members safe and healthy, because it will protect me. But every individual, I think, has to make that decision at this point, because we don't have those mask mandates in place. We don't have those. Now things might change. And I want to be sure to mention that, because in a few months, if mid to late winter comes when these viruses should have peaked, and they peak even more than they are now, and our hospitals are maxed out at capacity, then I absolutely think every single person's responsibility and civic duty would be to wear that mask to keep our hospitals protected and reduce the spread of the infection. But I think today, at this point, when there's still manageable caseloads and only some hospitals are starting to really feel the pressure, it's more of an individual decision, but I hope that more people will embrace it.
So how should, I guess my final main question is, how should people think about if you have the COVID and the flu vaccine, the newest COVID vaccine, and you're wearing masks in large public settings, airports, things like that, grocery stores, how should people feel about this winter?
I think they should feel like they can still live their lives.
Okay.
You know, I feel like, I mean, a part of reacclimating after the pandemic is to get ourselves socially back to where we were, but also to help our immune system sort of recover and be back to where it was before. But I think it has to be done safely, to your point. You can't just let it rip. We're not in that situation, and that would be a very irresponsible thing to do. You really want to sort of tread carefully, ease yourself, your body, and your social life back into normalcy, but with the right protective measures. Now we've all become very skilled at learning how to protect ourselves, how to keep ourselves and our family clean. So I think we're armed with that information, and we can use that as a way to kind of safely enjoy the holiday season this year and safely enjoy all the lovely things that we had to miss out on. And let's say you do end up getting sick, and this happened to me a few weeks ago. I had a little bit of a cold because I was visiting my niece and nephew, and they always have something. And I said, well, which one is it? Is it COVID, the flu, or is it RSV? So you can actually go and get, many places will offer a triple swab, where one single swab will be able to run all 3 tests. Now, if you have a sore throat, you may also want to do a strep swab as well to make sure it's not strep throat. But testing has to be a big part of our strategies this holiday season to keep ourselves safe and to keep others safe. And many of the same things that we've kind of forgotten, if you're sick, stay home, and don't be a hero, don't go to work if you're not feeling well. Many of those types of strategies we have to employ as well.
So it's not over. Unfortunately, I know a lot of us understandably getting back to where we were before, but we still have to keep some of those preventive measures in mind. And the good news is, I'll tell you what, personally, I'm getting my COVID booster and my flu vaccine on Thursday. So
wonderful. And we're smarter this year, so we know what we're doing.
I just wanted to brag in front of the doctor. That's what I wanted to do. But Dr. Kohli, we appreciate a few minutes of your time here. Thanks.